I grew up in Vancouver, British Columbia, and went to University of British Columbia when I was 16. In my sophomore year of university, after taking many science courses, I took a course in bacteriology. And from that day on, I realized that was the area in which I wished to focus. It was not till my final course in research in my final year that I met Walter. And he was in the herbarium at the biology department. And I was taking this summer course in studying chromosomes, so-called chromosomes of bacteria. And people in the department, two men in the department, started teasing Walter about going down to see a young girl in the basement doing research. And the first time I met him was when he burst through the door and said, "Hi, my name is Walter Lewis. I'd like to take you out for a cup of coffee." So that was the beginning of our adventure and getting to know each other over the years. When I was a young assistant professor at the dental school in St. Louis, Washington University Dental School, having trained in virology and epidemiology, among my other specialties, I was studying a few cases of Burkitt's lymphoma that had occurred in St. Louis, and that is more commonly seen in West Africa, where you have large tumors either in the oral cavity or in the ovaries. And in actual fact, it is an infectious mononucleosis, the Epstein-Barr virus, that transfers genes from one chromosome to another, and that's why it takes on a malignant phase. So Walter was invited with a group from the U.S. Department of Agriculture to go to Ghana to study their agriculture priorities, and he invited me along. And because they were studying the treatment of Burkitt's lymphoma at Korle-Bu Hospital in Accra, related to vincristine and vinblastine. And vincristine and vinblastine come from Catharanthus rosea. And so this was my first understanding of plant products that could heal malignancies. So that's how I got to Ghana the first time. And because I was in the dental school, I was asked my hosts what their problems with dental disease was, and they told me there just wasn't a problem. And I asked them why, and they said it was because the plants they used for teeth cleaning. So that became my adventure in my life of doing a critical quantitative ethnobotanical study of chew sticks in southern Ghana to find out from 125 species which ones were preferred, and taking them back to my lab, which ones were bioreactive against organisms that cause tooth decay. There was an outbreak of infectious mononucleosis in the middle school in Granite City. And what Epstein-Barr virus does on occasion is take genes from one chromosome, stick it onto another, and that's what Burkitt's lymphoma is all about, and it's much more common in West Africa. When I realized how bioreactive some of these chew sticks were against oral pathogens, I asked National Geographic if we could study this in a much more quantitative manner. So I collaborated with people at the University of Ghana, botanists, dental students, medical students, whatever, so they could go into their communities, that's 12 linguistic groups, and using a interview, ask the people in their own languages just exactly why they chose the plants they preferred, what was its value, what was their second choice, how did it affect dental disease, because it's very easy with 4 quadrants in the mouth to know exactly if you're having mobile molars or dental decay. That's not a big deal. And so we interviewed over 800 patients, 12 linguistic groups, crunched it through Fortran, and we're able to find that the most popular were the most bioreactive. And that has been the forefront of my study of ethnobotany throughout my career, is understanding that the most popular is also the most bioreactive. Garcinia afzelii, Garcinia cola are the 2 most popular, not only in Ghana, afzelii in Ghana and cola in Nigeria. So they're high in fluoride, and so that's one of the reasons why it worked. But they also have other bioreactive compounds in them. They're antimicrobial as well. Chew sticks in the U.S., not only among the native peoples, but also among those that came from Africa and North Carolina, and so like the Gullah. And so that if you're curious, the people that were the Gullah chose dogwood because it had the same flavor as Garcinia in West Africa. Not that they're in any form related to each other, but because of the flavor of the plant itself. Also, there were very few chew sticks that were used by populations of people that were partly African and partly Native American, but it was very interesting that, especially in Tennessee and areas, they used black gum quite a bit. That's made the best brush to clean their teeth with, and sometimes also they would use this to dip in tobacco. So there you go. Out in the Northwest, they used a lot of gums from trees to clean their teeth with. In the Bedouin ladies used gum acacia. The men used Salvadora persica. Now, as far as I'm concerned, the best chew stick in the world is Salvadora persica, which is in the Middle East. Now, you have to understand that you're talking about apples and oranges here. So for the people that live and use natural products, I'd say Salvador is by far the best. That's what Muhammad used. And before he died, he asked his wife to prepare one so that he could meet God in the presence of clean teeth. But to say that it's as good as some dental products, that would be an issue that I will not relate to at this point in time, because they're always changing the dental products. But if you want to know what I believe is the best chew stick in the world, Salvador beats it all. After I finished my study, which was first in Ghana, and then we went around the world looking at plants used in dentistry in the Middle East, in Pakistan and India, Oceania, everywhere. I came back and settled in back to my work, but I got restless again. So in 1982, I phoned National Geographic again, after hearing that people blackened their teeth in the Amazon. Now, that was fascinating to me, because the only place I knew that people blackened their teeth were in Southeast Asia and in Japan. And in Japan, it had evolved, the samurai brought it back with them, and it evolved into a way that Japanese women would blacken their teeth as a sign of fidelity when they got married. So you could actually see blackened teeth from that era all over in the paintings of Japan. And so that was fascinating to me. Now, on parts of Southeast Asia, this was a sign of maturing. So you blackened your teeth when you were ready to be sexually active. So it differed from different parts of the world as to why you blackened your teeth. Now, I didn't know why they blackened their teeth in South America, but I wanted to know. And I'd also heard that you could bloodlessly and painlessly remove a tooth by using a plant, so I wanted to see how that happened as well. So we went on this National Geographic grant. We went to Peru initially to study this, and Walter came along as my expert botanist. And we worked with Peruvian botanists in the field to be able to understand tooth blackening. And we found that the tooth blackening was used prior to visiting your neighbor's village because you were going to participate in recreational ayahuasca, not in the hard stuff, but in recreational ayahuasca, where you would share a hallucination around the hut that you were in. And you did that because of the acridity of the ayahuasca. And of course it had the benefits also of protecting your teeth from tooth decay. Now with tooth extraction, which we studied in Colombia, we realized that in Cundinamarca, where the coffee grows, that the buffering capacity of the water didn't prevent people from having tooth decay. So they found Chlorophyra tinctoria, or used to call them chlorophyra, but Chlorophyra tinctoria, that they were able to take the sap from and put it on a bit of cotton and extract their teeth with it. The Chlorophyra has been known for tooth extraction from Madagascar throughout Africa all the way to South America. And the closest relative in North America is the Osage orange. It's very effective, but you have to be careful on how you place the cotton with the sap on it, because it could extract more than one tooth. The compounds, there are different types of plants that are used, some to permanently dye the teeth black, that will stay, and you would never go into a village without touching up, and they use other plants for that. And so there are lots of tannin in these products, and sometimes fluoride or other compounds that are bioreactive, but it does bond to the teeth. Everybody knows how betel nut stains, so it's not an unreasonable thing to know that staining of teeth by plant products occurs throughout the world. The nice part about plants for dentistry is that there isn't any proprietary problems. Nobody worries about it. Everybody smiles when you ask them about it. Unlike medicinal plants, dental plants just don't have that same problem. When looking at medicinal plants per se, and looking at mixed formula, as well as just plants that are used by themselves, which is very rare, you have to look first at the genus and see what other plants in that genus is used for, because that gives you a hint to the commonality of the bioreactive compounds within that genus. And then you go further up and see the commonality of plant uses, medicinal or otherwise, within the family. But the one and the most interesting part about it is sometimes the plant that is used as a medicinal plant, the compound in it may not be the very best compound. So you can go searching within the related taxa to see something that may be more soluble, perhaps less toxic, or more applicable to be able to be used rather than the original compound in the original plant. Also, one has to think of there are, within a species themselves, there are chemotypes, so that you can't expect one plant that you collected from a spot to be identical to the same species that you collect in XYZ spots. So one has to appreciate that particular thing as well. But when you're looking at a potential pharmaceutical and want natural-based things, you have to look within the genera itself, in my opinion. But then again, it's not the compound itself that may be the very best. If you semi-synthesize it, you may be able to open up the particular rings and things and make it even more soluble, less toxic, and more applicable to in a pharmaceutical sense. So that they're all ways of looking at ways to enhance the pharmacological effectiveness of compounds within that group. Also, one has to understand that you have to be very careful about the mechanistic study that you might be doing in surveying for these bioreactive compounds, so that you can align that with the common uses of the plant by people originally. When you're studying ethnomedicine and the use of plants, one realizes that it's very rare indeed for one plant to be used exclusively. Usually it's a mixture of plants whose bioactivities complement each other. So I don't care if it's from the Indian continent or China or Japan, where these types of mixed therapeutic combinations have been written down, or where perhaps in the country of origin it will vary in the plants that are selected depending upon where you live. Otherwise, in the north of India, you'll choose Himalayan plants because that's Ayurvedic, but in the south of India, they may not have those plants, but they will choose other types of plants that will have similar bioreactivities. And that goes throughout. In China, that's particularly well known, and depending on what part of China you're in as to what plant you will select, or perhaps what plant you will collect in the time of year. So all these things are critical to a mixture, and one cannot say that the mixtures that are used for a particular treatment are similar from one time of year to the next, or one part of the country to the next. I was a senior author on the first case of AIDS in the United States, because that patient also had chlamydia infection, had lymphogranuloma venereum, and also had Kaposi sarcoma, which is another virus infection. And so it was a very, very difficult patient to be able to bring forward to my peers, because you weren't talking about a very simple clinical presentation, and they didn't want to believe what they were hearing. When I was in Haiti at one time, I saw neem plants growing, and I knew they came probably from Africa because that was closer than India, and found out that the people there had gone to West Africa to collect them because they were looking for root busting. They were looking for their ancestral roots, and saw neem, which was introduced in West Africa so that the people there wouldn't burn mahogany. And neem has become a weedy plant all throughout West Africa, but it has so many medicinal values because of the oil is anti-inflammatory, antimicrobial, and the leaves are, and the seed oil is anti-insecticidal. So they're all reasons for it to be medicinal and very valuable. But they had put them up in Haiti, which gave one a clue as to another reason why the back and forth from Haiti to West Africa occurred, and why HIV came over from West Africa, probably the Belgium Congo, or at that time, to Haiti. The dogmatic idea is the fact that Haitian physicians who spoke French very well had gone over to serve the Belgium Congo people because they were doing a great deal of mining in the Democratic Republic of the Congo. And so they went there to help out. So did Haitian engineers. They weren't unique. A lot of French went to do the same thing. And of course, that's how HIV was introduced back into Haiti. Somebody very carefully says that it was only one patient doing it. I don't believe it at all. And I believe that probably the problem with HIV was that it was in chimpanzees, and chimpanzees were bush food for a lot of people, and people got infected through butchering the animal. And then they would go into prostitutes, and then the other people from Haiti that had come over to serve had, of course, were usually by themselves, so they went to see the prostitutes, and there you go. This flight steward, who was homosexual and very sexually active, who picked it up in Paris, because, of course, the people were returning from Belgium, Congo to Paris, picked it up there and spread it throughout the gay community because he was very sexually active. That's how the big epidemic started here. Alkaloids, primarily. They're usually small enough and they're not too complex. Most ubiquitous compounds that are bioreactive and occur in a lot of plants are oxidative and bioreactive many forms are much too complex or chiral to be of any pharmaceutical value. But alkaloids, what you have to do if you're looking for a single pharmaceutical entity in a plant is have it small in size, stable, low in toxicity, high in bioreactivity. You don't find that very often. You did that with quinine, but you don't find that very often in a plant. One does not work alone or even pretend to be an expert in every area. So when we were doing the work for the ICBG, which my husband was the principal investigator on, and even beforehand when I was studying hepatitis remedies in the context of use, you have a camaraderie of spirit with a lot of specialists in a lot of different areas so that you can do it properly. You don't pretend to be all things for all people. I'm not a natural product chemist and grind and find person, but you can find them that'll do that for you. I don't speak certain languages, but you can find an interpreter to do that for you. I'm not necessarily a specialist in certain areas of even my own field, so you can find specialists to do that for you. So when you do your research, you have a long list of collaborative people, including intellectual property lawyers, to make sure that all the T's are crossed and the I's are dotted and everybody's happy at the end of the day. When we first went to the Amazon, there were not any rules or regulations about protecting intellectual property. It was our own choice not to make this commonly known. The sui generis laws that were evolved during the ICBG, the International Collaborative Biodiversity Grants, was related to working out with intellectual property lawyers and with the native people and with government officials what was the best way to ensure that there were some benefits back to the native people that we were working with. That was a hard task to follow because we were cutting edge. And I am very pleased to say that the work that Walter and his group did on this particular thing was lauded by the World Health Organization as one of the cutting-edge ways to do it. It was not easy because it was very misunderstood even by some academics that never understood what we were doing. And that's to my sadness, but that was the particular case. Also, you had some intellectual property lawyers that took out their violins and didn't understand what you had to do to get to that point. And working with pharmaceutical companies that were still in the old-fashioned idea of grind and find everything to see if you could find something didn't make much sense, because oftentimes you'd get a bioreactive compound that didn't meet the criteria, as I've said before, of safe, small, and whatever. So you had to be very persuasive to the native peoples and telling them you would provide them with benefits, but they would have to also be patient with the fact that it was going to take a long time and a lot of money to be able to do it. When we were working in the field with them, whether it was in Loreto with the Achual or with the Agaruna in the Cordillera, we always made sure we brought gifts with them. And with the Achual, it was usually all sorts of things that they wanted, from nylon fishing equipment to ladies' hair clips to Advil, because the women had never had something that would affect their menstrual cramps, and they were very happy to have that. So you'd find something that made logical sense, and we always brought a football for the kids. And so we made sure that when we were working with people, we would give them something up front to enjoy, that we weren't just taking without that. It was much more legally described when we worked at the ICBG, because we had to be, so that money was provided for the women to have their own particular ways of doing things in the villages to make money, and to have their little cottage industries, things like that, that were much more easily done, and making sure that certain good students got money to go and get secondary education and something like that. So we tried to find not only upfront compensation for these people to make them happy, including giving them some just money, as well as long-term, hopefully, benefits. Now, nowadays, anything that you've collected 20 years ago and that gets into the public domain is no longer protected by that. That's the laws in Peru. Whereas in places like Venezuela, they're very careful, I believe, even still, about what they will allow to be done and developed. So it depends on the country you're in as to what it is. It's very difficult to persuade certain ethnobotanists, or whatever you want to call them, in different countries to adhere to the rules and regulations the WHO has set out regarding informed consent, prior informed consent. And any time that I would review a paper and they didn't get prior informed consent, I would reject it. WHO has been very interested in medicinal plants for a very, very long time, because they recognize that in a lot of cultures, medicinal plants are the only way people can survive, because they can't afford pharmaceuticals. And pharmaceuticals can be badly abused, like antibiotics have in East Asia, because they have used them for a lot of, they're over-the-counter availably, and of course the development of resistance has been high, especially among enteric microorganisms. So one has to realize that WHO is interested in medicinal plants primarily because they know that the majority of the world doesn't have access to pharmaceuticals. With the ICBG, Fogarty International was there all along when we were doing the painstaking 2-year work of trying to set out the rules and regulations regarding the benefit sharing and protection of traditional knowledge. When we put in our second grant, not only did the reviewer not read the grant properly to realize that we were talking about many plant compounds, But the reviewers didn't understand that because we were legally bound not to reveal the name of the plant, but only cite it as with a number, that they couldn't understand why we were doing that. Now, natural product chemists and pharmacognoscists at that time used to grind and find anything, and they didn't care if they were protecting traditional knowledge or not. And they would publish these compounds without properly studying them, and therefore destroying their capacity to be able to develop them into reduced-to-practice pharmaceuticals. It was the nature of the beast, and it was also the nature of the beast and pharmaceutical companies at that time to go and collect thousands and thousands of plants without even any consideration for the ethnomedical background of that particular plant. So they were doing it all wrong, and they were maybe 5% hits that they would get, and if you do it all right, you can get 90% hits. So there is a difference on how you look at it when you really focus on the most popular plant, focus on that you believe is safe to be used and efficacious to be used, look at the compounds to see they're not ubiquitous, then you can find something that really, really works. But you have to listen to the people, and that's the way it is. For example, in China, they studied 1,000 plants for cancer, and then looked at where the hits were coming from. And the hits were coming from those plants that were used for cancer, not the plants that were used for other purposes. And so anywhere you look, you can find the same idea of looking properly and listening properly to how that plant is used. And if you do that and look at the compounds that are used, you can find things that work. Everybody uses computers now to sift the data. That's not unusual. That's not unique to Ed or anybody. I use computers all the time to sift the data. It's just an easy, wonderful way to be able to do it, because in the old days you used to have to fingers to do the sifting, and I still have to do that when I look at the pharmacopoeias from China or from India, because they're not necessarily out there. So computers make it a lot easier because there's so much data related to a plant, its compounds, its bioreactivity, and whatever. So it's not unique to any one person. It's the way we do it. I use it all the time. When Walter and I were young students, we were taught classically. And classically meant that you learned to identify the organisms that you were studying, whether they were plants or microorganisms or viruses or whatever, and understood what they did and how they did it and how they were related to each other. That's holistic biology. Whether it's in a plant, an animal, a virus, a bacteria, or whatever, you have to understand their relationships to each other and whatever. That's holistic biology. Nowadays, there's a tendency for people to go at a deeper level, not only at a molecular level, to understand how these living organisms work, but also what their genetics has to be. So very often in the wake of the love for that particular type of science, the students themselves forget where the organisms come from or how they're related to each other. It's just simply the mindset of the young scientists nowadays on how they do their work. And I'm not saying that they don't do eloquent work. It's amazing, beautiful work. But oftentimes, because of that, no longer is plant systematics taught at school. When people understand microorganisms, they're not necessarily taught the relationship of one plant organism to another. And that's, if you don't have that basic background, then you can't really go forward in understanding the relative value of the mechanistic studies you might be studying, or the biochemistry or the genetics. But that's what it's all about. It's just a mindset nowadays, because everybody's got these eloquent ways of looking at genetics and other things. And it's wonderful, but it's just a totally different mindset. And if you're classically trained, like Walter and I were, you'd go back to Mendel and Beadle and Tatum. Nowadays, you'd say those words and nobody would know in the world you were talking about. Understand, professionally, I'm a trained microbiologist. I'm professionally not a trained botanist. I learned botany by marriage. So there's a difference. But you can use botany as an example, because what you're talking about when you're talking about a herbarium and you're talking about botanists that love to collect is the fact that's holistic biology. And people that are trained to look at the inside of an organism don't understand the outside of an organism and the relationship to each other. Now, probably SMU did this because they saw where the money was coming from in the granting agencies. And so the funding for field work and the funding for that type of thing was being decreased. That doesn't say that it didn't occur, because, I mean, we got funding in the 80s because of where we were, which was in tropical areas which was the most biodiverse and the least known. So you have to understand that it depends on your specialty in botany if you would be beloved or considered redundant. And I think it was the fact that the people that were doing this had no concept whatsoever of the value or the basic knowledge of the relationship of a plant on the outside to the plant's ability on the inside. And that's the difference. But it's the funding idea and the dogma of the time that people chase the genes or they chase other activities in a plant. And I see in the seminars that are coming out of the Department of Biology on plant studies now, they're all related at molecular level to all sorts of activities that are going on within the plant. But I doubt that many of the students really appreciate the plant on the outside. So it's inside and outside, and where the money dictates that you can go. You're talking about the new generation of people that will carry on doing the type of research that they were trained to do under our tutelage, and perhaps others of the same ilk. There always will be. It's just a matter of how it's funded that will make it relevant or not. And I think that's the most important thing. Ed Kennelly is great because he's studying medicinal plants of a country that has used them for millennia and understand the worth of and value of these plants in their pharmacopoeia. When I was working, I understood and appreciated the value of plants in Ayurveda and other medicinal systems in India as well, because it was in those cultures that they wrote down what they were doing. There, if you go and see the studies that have been done in Africa or elsewhere, really when you look at their pharmacopoeias, they use as many mixtures as anybody else did. It just simply wasn't recorded. So it's very difficult to go back now, even though you know the mixtures, and find out the data that you'll find in these ancient cultures that recorded so much of the information that was going on. That's the difference. It's where you do your mining that makes the difference. But if you go in studying hepatitis remedies in the context of use throughout the world, there's always a commonality that you find. So people will be selecting the same families, the same genera in different parts of the world for the same things. And I think that's, to me, the most important thing, is to understand that it's not necessarily set in blood to one continent or to one medicinal system, because when you really look at it, people are choosing the same related plants for the same things all over the world. But one can look at the future and say, with the multitude of plants that you have, there's always opportunities to find different ways to be able to study them. It's just whether you can fund that and find out what the priorities of the countries are, or entities are to publish that particular thing. So that's where it's all at. I can't predict what's going to go on any more than anybody else can, because just like diseases that are flavors of the month, so are focuses on scientific studies of the day. So you never know when all of a sudden things are totally going to change. For example, the development of CRISPR to be able to cut and paste genes all over the place may have an amazing new impact on the value of certain plants that you don't even appreciate now would have any value in themselves except a hidden gene or two that might be nice to put into another plant. So I think that one has to appreciate the fact with evolving technologies, one has to look at how valuable gene mining is going to be. And I think if I look at it from that perspective, it's gene mining that's going to rule the waves in the next little while. As I say, it's still valuable to have herbaria. It's still valuable to have people that are collecting plants that are very rare, knowing where they're being extirpated, understanding the value of these things. Yes, that's part of the deal. But you have to wake those people up to who are starting to do the gene mining to realize the potential they have if they really go shopping in the related species and genera to look for those special genes that are special. Because those genes may have nothing to do with the plant itself as being valuable. It would be if you could place it into another plant, another species, and make it work properly. I wrote a book on herbal remedies safe. Not a book, but a chapter in a book. And I started out by telling people just exactly what an herbal remedy was and how the different countries of the world looked at their pharmacopoeias and how they looked at it from the point of view of safety factors. In doing so, I was able to identify problems around the world where not only adulteration but safety factors were not being properly addressed. So that the heavy metals in Indian formulations was a major problem. Adulteration is often a major problem in the fact that of the use of the plant that might be used or putting in another plant that might be used. And this is similar in any country where they think they can get away with this particular practice. So one has to be very, very cautious about the sourcing of the plant as well as the company that's doing that particular formulation, because some are nefarious and some are particularly responsible for what they're doing. There's always this situation when it comes to use of medicinal herbs. Also, people that like to freely collect their medicinal plants often don't know what they're doing, so that comfrey and digitalis look very similar when they're young, and people that try to take digitalis can die from that particular mistake. So one has to be very careful, and people have to understand that there are reasons for plants being carefully understood before they're put in any remedy. The old herbals, for example, were not sacrosanct, and they had problems with a lot of their remedies. And I think, for example, pennyroyal used as an abortifacient was a major problem because it's very toxic. But around the world, and I think people have to understand it to this day, abortifacients were very common in every culture that you found. So it's not unique to one place or another. And similarly speaking, one would find a particular remedy that might be used in one country or another country, and one has to understand what they consider their parameters of value and use and how they used it, and you have to be very careful in the context of how they used it. What I take exception to, and I constantly do take exception to, is the fact that you get nowadays on the internet all sorts of claims being made that are invalid, not safe, and people thinking they're experts on a situation when they're not experts on what they're saying or doing, and people are making mistakes and getting into trouble physically because of that. So one has to be very careful about the remedy you use and how you use it, and the side reactions. Nowadays, the reporting of adverse reactions is still part of the FDA, but it takes a long time for that to bubble up to the surface. And of course, you will always find some large pharma companies or large companies that will try to cover up some of their mistakes in what's happening. So you have to be careful that who you trust when that goes on. And that's the bottom line when it comes to use of herbal remedies. You have to know your source, how the people use them, who the experts are, and what the value is, and not just trust old reports. Now, where this all came to lie is when the telegraph worked. And in the turn of the 20th century, when we had telegraph lines all over, all of a sudden, all these snake oil remedies that we heard about from people that were getting ideas from indigenous people that weren't necessarily valid or not, the adverse reactions were being reported in the literature. And one can go back to that time, as I have, and I've seen those adverse reactions. And that's what made people very scared of using natural products. And because of the adverse reactions that were coming and surfacing to the point. So the concept and idea that was evolving from the beginning of the 20th century up through, above the 80s, was the fact that one compound, well understood, was the dicta of the day. Saying that, aspirin would have never got through the FDA because it's anti-inflammatory as well as analgesic. But the idea of one compound, one value, one use, one safety parameter was part of the deal until the 80s or the 70s, when the flower children all of a sudden began to discover the old herbals again. And that was a real concern to us, and that's why we wrote the book Medical Botany. And we based it, as I said to my husband, my training comes back from internal medicine, so you base the book on internal medicine, not on just the plant and blah, 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 what it's used for. You put it in the context of the type of disease entity that you're studying, so that it has more value and more logical sense, and then you can go from there. And that's why our book has been still valuable to this day, even though a lot of the things are out of date and I wish it could be rewritten, but that's not for me to do. When we revised the second edition, we really went gangbusters for a year. And we worked 18-hour days, 7 days a week for a long, long time. And we sometimes shared a chapter, sometimes did chapters individually. Our approaches were different in how we wrote. Walter preferred a copy editor with him all the time. I preferred to do my own thing. And that's what we did. And as I was saying, at the end of the time when we finally finished doing absolutely everything, it was like getting off an airplane where you've ridden at the very front seat of the airplane. You were leaning forward and you didn't know how to sit back for a while. It was just that exhausting. Discovering the fact of marrying plants with my specialty, infectious disease, and understanding the disease process to some degree in other aspects was perhaps a very exciting new chapter in my life, because it wasn't just being able to identify the cause of a disease. It was being able to see how that disease might be treated by people around the world. And it took me to most of the continents of the world to meet wonderful people, to understand different medicinal systems that use plants. And I wish I was still young enough to be able to continue to do it, which I am not. But it has been a super exciting life, and I thoroughly enjoyed every minute of it. The issue with understanding plants per se, botany per se, is an old concept and idea of familiarity breeds contempt. So several years ago, when I was traveling to a conference in the spring of the year with a colleague of mine from the dental school who's a physiologist, I could see all the beautiful spring plants on the road. He didn't see them at all. So what I learned from that is what you learn to look for in anything you're doing, and what you tend to be absolutely blind in recognizing. And it occurs in every area, specialty of any kind whatsoever. It's not unique to natural sciences. It's probably unique to what we do all over the world. So I would like to see children start learning plants, about the value of plants earlier. And I've suggested just take a whole group of children to a supermarket, and especially to one that may sell exotic food plants. Get them to choose something that they've never seen before. Go on the net, find out all about it from its origins to what it's used for, put it on a map at school, and go from there. That's a fun project to do and exciting, and it can start at a very young age and evolve where kids are really using computers. But from that way, it'll give them a better appreciation of at least food plants and where they originated from and how they're used now and how they're common in marketplaces. Because I know when I go into supermarket and I want to buy rhubarb, a lot of the checkers don't know what in the world it is. It's red celery or something like that. So I appreciate that even in the supermarket, some ordinary plant that you use like rhubarb, a lot of people don't know what it is. I mean, I don't know what some of the vegetables are when I go into a global market. So that's what I'm simply trying to say. It would open people's mind to have some of these more exotic vegetables and fruits explain as to where they come from, why they're used, and why they're particularly valuable and useful. And having traveled the world and lived within the jungles, I know there's a lot of fruits that I miss when they're beginning to ripe in the spring and summers of that particular place. And I miss them. And so it's not like it's that people don't know how to use an edible plant. And that's the beginning, is to learn something about edible plants, where they originated from, who provided them to you. I mean, I am fascinated how, for example, in Korea, they love corn. And yet corn comes from North America and Central America. It's the fact that every country of the world is adapting and finding plants from another part of the world that they really love, like how tomatoes evolved. Or a friend of mine who's Irish that had me laughing till I couldn't stop when he said he brought some potatoes back from Ireland. I said, "What are you talking about? They all come from Peru." I mean, it's the concept of people and the way they look at the plants that are valuable. And I think understanding edible plants is the beginning of appreciating what else can be used. Of course, there are certain plants like jojoba that make it possible to have that oil so that you don't have to worry about killing whales. And there's all sorts of things that can evolve and be discussed with children to make it valuable to them as relevant to their world. It's just studying plants per se for the sake of plants per se for younger children and even kids in high school is not going to make a difference. We realized when we gave some talks at a private school years ago, it was the middle school children that were most fascinating, that asked questions up to a level of a doctoral student, not the high school students who were into their own heads floating away and could care less about what we were talking about. So I'm just simply saying I've observed it for ourselves. Now at university level, of course, they can go into much greater detail, but you have to have people that are interested in marrying holistic concepts with molecular concepts to make it valuable. No, it was by far the most popular undergraduate course in the university. And it had way over 150 students. And to the point, and he had kids that had the course beforehand that helped. It was by far the most popular course that was taught. And people tried to duplicate it afterwards, and it really didn't work because they just didn't have the background. You see, botanists try to do it with a medical background, you can't do it. Walt would have allergists come in, I would come in and do my stuff. We were able to bridge, we learned a lot about medical systems as well as botany. If you don't have that background, you can't teach it. Not that well. You have to know both sides of the coin to be able to do it properly, because otherwise you're just faffing around. When I was studying hepatitis remedies and the concept of use in the Amazon, because we wanted to be able to identify those that would help those people that were dying of hepatitis B delta, I was able to identify the most efficacious of all of these plants. It was not used alone, it was used in mixtures to enhance the therapeutic value, its therapeutic value, but be as it may, it was by far the most efficacious, and we had studied it with my colleagues at NIH to show that in vitro studies it had real effects against these viruses. Unfortunately, in one large village where the outbreak had been very severe, the most efficacious plant, which was a tree and was being harvested for its roots, became extirpated, so that there weren't any of those trees nearby. So when we were concerned about those people that had chronic infections with hepatitis B, we had to look for an alternative. And we were able to do that by finding a sedge that was useful, not as potent, but still very useful. And we had those people use that to treat their chronic infections, which was very helpful. As long as they took it, they didn't have any episodes of hepatitis B. But what we learned from that particular thing is that it's very difficult, no matter where in the world you are, if people need a plant, and there isn't any resource renewable policies in effect, which clearly would not have been in the middle of the jungle, that you have to really be concerned about the extirpation of certain species. And this happens all over the world, it's not unique. There is also concern too that when these things are happening, that those people scurriest people in the herb trade that need to, shall we say, fulfill a quota will adulterate either with other less potent species or some other plant species that may look alike but have dangerous compounds in them, that there is always this issue of knowing what your source is of any medicinal plant. In addition to that, I know that there are many very fine herbal trade people that are very responsible for what they do and how they do it. So the difficulty is knowing your source of your herbal remedy and being satisfied that you've been given the proper type of plant and the proper concentration in it. Because neo-Western herbalism is very common in the Western world, where they combine plants from different cultures, whether it be East Asia or West Asia or European sources or maybe South American sources into one remedy. It is always very, very difficult to ascertain where those sources come from. But most importantly, if it's a plant that grows in North America, you'll have people going out trying to find the herb that they can use and not have to buy. There's a problem with this because amateur botanists are still amateur botanists, and they don't have the training to be able to distinguish between closely related taxa or those that look alike that may not be the same. And so that there is always a danger of them selecting the wrong type of plant. And this is always a concern with people. Also, it's a concern that they may identify the source of something in the wild and totally extirpate it. One misidentification that I know about was one where an individual in the Pacific Northwest was out in the springtime looking for comfrey, and comfrey and digitalis are very common in that area, and unfortunately they chose the digitalis rather than the comfrey and killed themselves because digitalis in itself is not in the right concentration, is very lethal. One has to understand in science, regardless of what science it is, there's always the flavor of the month. And the flavor of the month rules the waves related to dogma, and it rules the waves regarding to funding, because you have the funding agencies, and you also have the review panels that are, shall we say, into the current dogma. So it's very difficult to persuade somebody that understands the value of molecular, whatever it might be, to understand a holistic basis of that particular specialty. I don't care if it's an animal or a bacteria or a virus or a plant. Right now, molecular is where it's all at. They want to understand how an organism ticks in the finite ways. And as I said before, one can forget the cover to see the inside of anything. And so now, but the marvelous part about these techniques is that what they're really trying to do is understand not only how it ticks at the molecular level, but also at the genetic level. And the basis for the future is understanding the genetics of any organism. This means that it's very difficult for young researchers to understand the value of being able to identify the source of what they're studying. And there will always be the chairman of departments, and there will always be deans of faculty that realize that they have to make money on their scientists these days. It's not like it used to be 50, 60 years ago, where you were hired to teach and also do research, and that was fine, and they'd pay for it, and you didn't have to worry about generating funds. Nowadays, unfortunately, it's big business in any university. Everybody has to earn their way or they're turfed. And that's an unfortunate way. And so the flavor of the month is now molecular, but it's really the basics is genetics. And genetics will rule the future regardless of where you're at. It's a pity that because of that, a lot of other specialties are being sidelined, But for those to research is when they've almost lost the whole group of specialists in an area to realize how very valuable they had been in the past. With the way the world is evolving, they will be using DNA labeling to determine whether a plant is unique or whether it's not. They will be able to use some type of instrument that will tell them what compounds are in it. And so you're going to have a new group of field botanists evolving that do not look at all like the classically trained botanists that used to collect just determining what a plant looked like from the outside when they're more interested in the inside. It's not wrong, it's just that science evolves. I will always say that there will be amateur people that will still like to do classical anything, and that's fine. But there's always a concern when you have amateurs, when they don't have the appropriate training. And clearly, a course in plant identification and things it could be put online so that people could be able to do this properly. It need not be taught at a university. It could be done online. So that's the way people are these days, so that they would learn how to do this, so that there wouldn't be as many mistakes as there probably could be. And what are they going to do with the herbarium specimens, and who is going to take care of them that way? But I guarantee you, in the future, a new type of botanical collector will be out there that's hard for us to determine or realize because it's not our future. But that's the way the future is going to be. And I see it evolving. I hear that occurring sort of in the distance. And I think that'll be in a very exciting way for those of us that are no longer alive. We'll be seeing botanists evolve because they have to. If Walter and I did something that nobody else did and made a difference in this world, that's a legacy that I can live with. And going forth and looking at other medicinal systems around the world, still my goal, as long as I can travel. But I'm getting to the stage where I know that it will be limited. But I remember what my mother said, travel as long as you can, because the rest of the time you're just sitting around dreaming about it.